Hi everyone, I'm Namita Jain, a wellness specialist and an author. I'm at Bombay Hospital in Mumbai and I'm delighted to interact with Dr. Nupur Kapoor Nerurkar, a renowned voice surgeon. Doctor, a lot of professionals, singers and teachers and public speakers, those who have to constantly use their voice, they have certain concerns often. So what are the concerns people come to you with?
Hi Namita, thank you so much for this interaction. Yes, we do get a lot of professional voice users who come to us. Typically, as you mentioned, we have singers and we have teachers. And typically because they need to talk so much and that's a lot of vocal overuse, sometimes they don't use a mic, especially teachers in our school system. So that leads to sometimes vocal misuse. Then they come with very commonly issues which are bumps on the vocal fold known as vocal nodules. That's one of the commonest things. Even politicians in fact come with that problem. And that's something which is really taken care of very well by just voice therapy exercises. You know, like we have physiotherapy exercises when something goes wrong with the head. We have voice therapy exercises and we have a great voice therapy department in Bombay Hospital with 3 therapists, including a singing therapist. So these exercises then make the bumps kind of settle. Think of it like an athlete who's running a lot and develops like a corn on the sole of the foot, and you want that corn to settle. It's similar to that, you know. So occasionally singers may have other issues like polyps or bleeding within the vocal fold, when very often medication may help. And occasionally we resort to surgery.
Okay. Doctor, does diet, hydration play an important role in maintaining vocal cord health?
Namita, that's a great question you've asked, because hydration currently is like the hot topic, if I may say so. So we all know about systemic hydration, where you need to drink a lot of water. At least 2 liters is the norm, or you can say pale pee, the urine should be pale. What is also very important is surface hydration. And what we mean by surface hydration is not steam. Steam will actually dry up the vocal folds. So that's not what you want for your vocal folds.
That's a very interesting takeaway, doctor.
Yes, because this is a misconception. And what is very important is, to use something like cold steam. So that's something like a nebulization with sterile water or saline, which can really help in making all the thick mucus really, very sort of thin, so it can be swallowed very easily. So systemic hydration and surface hydration. And then of course, if you eat very spicy and oily food and you eat it late in the night and then you go to sleep straight on it, then you're bound to have laryngopharyngeal reflux and even GERD issues or acidity issues. And that's not going to help your voice. So we do recommend 2 hours of a gap between dinner and going to sleep. And we do recommend a little bit of a head high or elevation, so like 2 pillows under your neck. Some people have a neck problem, then we say you can elevate the head end of your bed. And the water which you drink should be not 1 liter in the morning, 1 liter in the night, but through the whole day. So these are just simple tips and tricks, and you can have green tea, warm green tea works wonders, and not more than 2 cups of coffee ideally, because it's a dehydrating agent.
So what about water temperature? Would you say cold water is not recommended, or do you think it's fine?
So honestly speaking, it's the systemic hydration where you just need water. Whether it's hot or cold, room temperature, lukewarm, doesn't really matter. But with everything, sometimes certain things don't suit people. So if cold water does not suit you and you get allergies or sneezing, etc. because of it, definitely avoid it then. But there are people who have ice cold water and they're fine with it. So whatever suits you, water is water.
So it's different strokes for different folks.
Absolutely, yes, absolutely.
Thank you so much, Dr. Nupur, for this very useful wisdom. Thank you.
Thank you so much.